Just when COVID cases were starting to settle down, a new COVID subvariant is rapidly spreading across the country.
It's a new Omicron subvariant, and while researchers still don't know a whole lot about it, it has been detected here in San Diego. CBS 8's Regina Ahn spoke with two doctors about what it is and what we can expect.
After the wave of Omicron came and went, this subvariant now accounts for 35% of COVID-19 cases across the United States, and it continues to spread, a 12% increase just from the week prior, according to the CDC.
So it's about 30% more transmissible. The two other things we always worry about, is it more virulent? No. Denmark data and UK data shows it's not more virulent than BA-1. And then the third question is, does it evade our immune responses from the vaccine? And the answer there is no.
Dr. Monica Gandhi, infectious disease specialist at UCSF, says those who are fully vaccinated with the booster should be protected against mild infection. But there's something brewing, according to Gandhi.
And on top of it, we have at a very low level something called Deltacron, which is a combination of Delta and Omicron, which just kind of proves that it's a hybrid monster, essentially, and it just shows how clever this virus is.
BA-2 in Southwestern states like California has made up an estimated 41%. Here in San Diego, it's been detected in our wastewater. While much more transmissible, Dr. Peter Chin Hung says it's not as severe, but he does worry about some categories of people.
Older than 65 and unboosted, because we know that if you're not boosted and you're over 65, you have a higher chance of getting into the hospital.
Chin Hung adds those unvaccinated and those immunocompromised. Doctors say it's not clear whether the rise of BA-2 will result in a major surge that will strain hospitals. What we do know is that coronavirus will be with us for a long time to come.
I'm probably not as worried about BA-2 as much as the fact that we remain vulnerable to getting a new variant at some point in the future. So I think, if it's going to be the fall or late summer or the winter, nobody really knows. But we need to prepare, the house for the storm that's going to come at some point.
Both doctors recommend keeping yourself protected by getting fully vaccinated, keeping yourself healthy, and not throwing away all your masks just yet. Most vaccinated people will see no symptoms or very mild symptoms, and health officials say this virus rarely results in hospitalizations or deaths.